Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everybody. My name is Dr. Ahmed Mamdouh Duhaim. I'm an orthopedic surgeon specializing in. Today, we'll be talking about some of the most common conditions that we encounter in our practice and can be of concern to the parents. First of all, first condition to talk about is hip dysplasia. To understand it better, hip dysplasia is not like a single disease, it is more like a spectrum of diseases ranging from very mild forms up to the severe form. What is common in all of them is that we have a very shallow socket of the hip joint, which is not really fitting the top part of the thigh bone, which we call it the head of the femur. So the disease to a very severe disease where the head is completely outside. Usually parents of newborn children, they read about it a lot and really concerned, do my child have it or not? And usually this necessitates some sort of screening immediately after the birth of the baby. And usually the person performing this should be the pediatrician who receives the baby right after birth. Clinical examination can reveal if we have some sort of displacement or dislocated head of femur. And sometimes this screening is not performed, so it is recommended to have an ultrasound scan in the first few weeks of life to confirm whether we have this condition or not. Hip dysplasia by itself is a painless condition, and if left undetected, it usually will show when the child starts to walk. Child will be, if he has one hip, he will be limping. Usually, if there is two hips, it will detect it a little bit later than this. Diagnosis will rely on the first weeks, like we said, on ultrasound, clinical examination, and after the age of 6 months, an X-ray would be confirmatory for the condition. Treatment usually will depend on the severity of the condition as well at which age the child is coming for diagnosis and treatment. In the early few weeks of life, early few months, usually we can start some trial of conservative treatment in the forms of some special braces to be applied to help to maintain the position and to help to develop a healthy or like a more deep socket for the hip. If this is not really helping, then a trial of putting the ball inside the socket under anesthesia can be tried, combined with a period of cast immobilization in cast for a few weeks after. If the child is presenting at a later age, like above 8-10 months old, or presenting at walking age, at this time they will require a surgery which will combine some sort of opening of the joint, putting back the head inside the socket, combined usually with some bone procedure either on the pelvis bone or the thigh bone. Prognosis usually will depend on how good was the treatment to maintain the head inside the socket. Second condition we'll be talking about, and we'll see a lot of it, and it's usually some sort of concern to parents, is flat feet. Parents come always with this question, my child's feet are flat, I'm not happy with the way they look, they are not really performing well in sports, and it can be a matter of concern, and they hear a lot of things. Do I need insoles? Do I need special treatment for this? How to prevent it? So what is flat feet? Flat feet is a condition when the arch of the foot collapses and disappears, and the foot have a flattened appearance when standing. This we will classify it as two main groups, what we call a rigid flat foot and a flexible flat foot. The difference between these two, that the flexible flat foot, by manipulation of the foot, we can restore to the normal shape of foot, while the rigid will remain always flat. Rigid usually is caused by some condition where there is some abnormal unions between the bones of the foot, and they require some specific treatment different from the classic flat foot that we are talking about. The other flexible flat foot, we consider this like a developmental condition, not really a disease, because most of the children, they are born with flat feet. And with development and growing, the shape of the foot starts to correct. The diagnosis for flat feet will depend on examination of the child, assessment in the standing position and non-weight bearing position. Sometimes x-rays are required. A history will be required if these are gathered together to reach a conclusion to what will be the treatment. In children where they only have a flat foot but really no symptoms, like they do running well, they walk, they don't have any symptoms, treatment is not required. And insoles even will not help to create the arches. So we are not really recommending this. Some other children, they will have some pain while performing physical activities. Those may benefit from insoles to reduce the muscle load and to help to alleviate the pain. Other children will have more severe symptoms, more pain. These children will benefit from a more aggressive approach like surgery, or sometimes some physical therapy can help also to alleviate these symptoms. Third topic we'll be talking about today also is tiptoeing. Tiptoeing is a common complaint. We see lots of kids coming with their parents complaining that they are not walking on their heel. They prefer to walk on the tip of their toes. And to classify tiptoeing, we have two main categories. We have one, what we call a habitual tiptoer. It is usually children between the age of 1 year and 2.5 years old. And these children, they, for some reason, they prefer to walk on the tip of their toes and not putting the heel down. And there is no structural abnormality in their feet. And what is required for this is to wait and observe, and usually at the age of 2.5 years, it should correct. If it doesn't correct, then some kind of intervention for this may be necessary, like applying a cast to the foot or some kind of special boots to help the child get used to put the heel down. The other group of children who walk on the tip of their toes is children who have some structural abnormality in the foot, like a tight capsule of the ankle joint, tight tendons on the back of the heel. And this is usually seen in patients who have like cerebral palsy or some muscle degenerative conditions. And this patient will usually benefit from physical therapy as stretching of the leg and calf muscles as well as the Achilles tendon, and in severe case, contracted structure in their foot. Our first topic today also to talk about is in-toeing, and usually complaining that their child are having an in-toeing gait. What we mean by in-toeing gait, that when the child is walking a straight line, his feet are not looking forward, they are looking to the inside. They are angled to the inside. And for this, we have different causes to cause this condition. And we'd like to classify, or not to classify, like to tell the origin can come from one of three places. It either can come from the foot, or the leg bone, or the thigh bone. Any twist or rotation in any one of these levels can cause the foot to look inward. So if we have like a foot deformity and the foot is looking sideways, then the child will be walking with his feet looking inside. If we have this twist coming from the leg bone, then the foot below will turn with it. Same as with the thigh bone, the whole leg will turn inside. Usually what we see very common between the age of 1 and 3 years is the twisting coming from the leg bone. And usually this is a developmental condition, and it should correct with time and growing of the child. Last cause can be also coming from the hip bone, and it is twisted, and usually we notice this at the age between 3 and 8, and also it is a developmental thing that should correct usually at the age of 8 and 10. And now I'd like to introduce Miss Kimia from marketing department. She will have some questions from your side, and I will be happy to answer them.
Thank you, Doctor, for joining us for this wonderful session. I'm sure everybody who's listening to you would want to know more about these conditions, especially when it comes to children. You know, parents tend to get a little bit more worried and a little bit more scared about how their growth and, you know, any deformity, God forbid, how to cope up with it. One of the questions, Doctor, is this hereditary? Does it come down through genes?
Some of them can be linked genetically, okay, but most of them, no, they are not usually genetic. We have for the hip dysplasia, but these come from the child side. We have an incident that children who develop hip dysplasia, their mother could have had the disease before.
Okay.
But we don't know the incidence. If the mother have it, what is the percentage of transmitting to her children? We don't know.
Is it because of some deficiencies in calcium or any other vitamins or nutrients during pregnancy that it leads to this?
No. It is usually the theory for hip dysplasia. It is what we call overpackaging. It means
4 conditions that we spoke about. Which one is the one that makes the child most, you know, immobile or more difficult to move?
Usually, no, they will move.
Okay.
In all of these, they are able to move. Most of them are painless conditions.
Okay.
There is no pain.
Okay, so how does a parent know something like this? Because kids, obviously, because when they're babies, they cannot speak.
After delivery, like I said, and if not, they will require an ultrasound, especially if there is a family history, especially if it's a firstborn baby, they should have ultrasound.
They should have So is this something, for example, when the baby is born without any deformity, but it's gradually the mother has noticed it, or there's something that is not right? How does this happen often, or is it something that's come from birth?
No, not coming from birth. Hip dysplasia, we have an incidence of about 1 in 1,000.
Okay.
1 in 1,000 baby, it can happen.
Okay. And what about the other conditions, like we said, tiptoeing and flat feet?
Other condition, I mean, flat feet, like we said, most of the children are flat-feeted, okay? And when they grow, they start to develop having normal shaped feet. Some of them do not.
Okay.
Okay. Some of them, or most of them, will be asymptomatic. They will have no issues with walking, running. Some of them will have some pain or some difficulty with this.
Okay. So if there is a child who is asymptomatic and does not have any, challenges in the normal life, do you yet recommend therapy or surgeries for them?
For the hip dysplasia, yes.
And for the tiptoeing, it's not flat feet?
Tiptoeing, like we said, we have 2 categories. What we call habitual tiptoers. It means children who do not have any abnormality in their feet. They like to walk like this.
Okay.
When they are young, before the age of 2 and up, we just observe. If we leave them beyond this age, they can develop an actual shortening of the tendons and an actual contracture. So at this time, we need to interfere. The other children who have a short Achilles tendon or contracted structures behind the ankle, no, they require treatment as soon as it's diagnosed.
Okay.
I mean, to walk like this is making you spend more energy.
Yes.
So you get tired easily. So the children who walk like this, if they have other conditions, they cannot walk for a long time. They get tired easily.
Okay.
So this is to make the energy they spend on walking less.
Okay. So all these conditions, does it affect any other body part, like for example a spine or any other? Does it cause any stress on any other health challenges for that matter?
It can, yes. I mean, like for example, if we talk about flat feet, sometimes the foot is really mobile.
Okay.
And it flattens too much to the degree that it can cause stresses to the ankle joint, knee joint, because when you have your foot coming to the side, your ankle joint is not more horizontal to the ground. It is inclined, same as the knee. So this can cause stresses in other joints as well.
Okay, so it does affect
Yes.
the other things. At what point do you recommend surgery for these kids? Because they are at a growing age. So understanding being that as they're growing, if we can use other methods by and everything
I
gets
mean,
fixed on its own?
apart from hip dysplasia, hip dysplasia requires intervention as soon as diagnosed.
Okay.
Depending on the age, it can be conservative measure like bracing, like cast, and if they come older, no, they will require surgery. The other condition like flat feet, tiptoeing, in-toeing, depending also on the cause, depending on the age. If it is still amenable to correction with growing, we just wait and observe. Like for example, in-toeing.
Okay.
Okay. If beyond we reach the age beyond spontaneous correction cannot occur, then surgery can be an option for these children.
Okay. So, and you spoke about braces, using hip braces. How long can a child be on those braces? The duration?
For the hip dysplasia, depending on the stage, depending on how it looks, so it can be from 2 to 3 weeks up to 2 months.
Okay.
Usually with this brace, brace is used to help push the head back into the socket and make the head press on the socket more so it can develop into a more deep socket.
Okay.
So it needs a little bit of time.
And then it'll gradually go back into the socket, and then the child can probably.
Yeah.
And then how often are they supposed to come for their x-rays and ultrasound just to make sure it doesn't go back?
It depends on it. Usually, if we diagnose this and we use this brace, we recommend having ultrasound every 3-4 weeks.
Okay.
Just to make sure that we are going on good track. It's still getting inside. The parameters of the ultrasound are improving.
Okay. Do massages help? If giving a massage with certain oils, will this help the
No,
cause?
not really. Okay, in hip dysplasia, it has no role. Other conditions, there are bony deformities.
Okay.
But physical therapy can help in some of these, yeah.
Okay. And do you recommend physical therapy for babies?
For hip dysplasia, no. It doesn't really have a role. For flat feet, if the flat foot is associated with a short Achilles tendon, yeah, they would benefit. The tiptoer also, like we said, if we have a short Achilles tendon, they can also benefit from physical therapy and stretching, yes.
Okay. Can one condition lead to another condition? So for example, we spoke about tiptoeing. Can it lead to an in-toeing condition as well, or they're not related?
Some of them can be related. Like, let's say, for example, hip dysplasia. Like we said, we were asked about the cause. We said it can be tightening inside the uterus for the baby. So when you have this, there is a tendency also to cause some deformities in other parts. So congenital conditions, some of
Or any certain things that
really.
I know you spoke of.
Okay. The baby will walk with a limp if he has one side only. Okay. And if he has both sides, he will have an awkward gait as well. So they are walking. Okay. Flat feet walk also, in-toeing, they are all walking. Okay. But the walk can be especially for the tip, they have flat feet. Okay, when they start to walk, it looks like this. And some of them develop slowly into normal feet. So the parents will come at this stage. In-toeing also is also developmental. Okay. Some of the causes of it is developmental. So we have lots of parents coming from this, yeah.
So you said with flat feet, it is first flat feet and then it gradually can also grow into a normal feet.
Yes.
What is the duration that parents should be holding on before they come in for a test?
There is no real consensus, but usually 6 years, 7 years. Okay, it will start to show if the child has symptoms or not.
Okay.
They can remain flat feet and have no symptoms at all. They play, they run, they walk. They are not getting tired.
So in those cases, it's not necessary to do anything?
Yeah, if we don't have any symptoms at all, just the shape of the foot is flat, no treatment is required for them, just observation.
But if this is not cured at a younger age, does it cause any challenges in the future as they grow old?
Usually no.
It doesn't?
Yeah, usually no.
Okay, fine. One of the last questions, doctor, any suggestions for the parents who have children who are going through these conditions? Because I'm sure as parents, you'd want your child to be perfect, physically healthy, physically fit. Any suggestions for the parents of how they can handle and take care of the kids who undergo these conditions?
If parents notice any abnormalities, they are not really happy of the way, they can come and visit, requires treatment, or at least to get the peace of mind.
Okay, all right. Anyways, thank you, doctor, for joining us for this session. I'm sure everybody who's listening to us has definitely benefited from this, and we'll have more questions coming in. And thank you so much for being here, doctor.
Thank you, and thank you so much for being here today. This was Dr. Ahmed Mamdouh Duhaim, a pediatric orthopedic surgeon from Medcare Orthopedic and Spine Hospital. Thank you.